Dealing with HS can come with a lot of other frustration. It can be painful, it can be embarrassing, it can be something that's hard to discuss with other people or even share with people that are close to you. First off, starting with location of the lesions. These spots tend to be under the arms and the fold between the hip and the groin or under the breast. The pain associated with these lesions can be so uncomfortable that it does affect our day-to-day actions. They can actually affect our mobility or movement because they're in those areas of skin where the skin folds together. As those deep-seated nodules really come to the surface, they can drain. The odor associated with the drainage is something that they're always somewhat aware of and can be very frustrating to figure out how to manage that because you can't really mask those types of symptoms. That's when patients get really uncomfortable. Not only are they dealing with the pain and tenderness, but a lot of times people with HS will often deal with chronic bandage changes, wound care, that just becomes very challenging to deal with on a daily basis. I've had patients that have said the bandage changes become so cumbersome. They feel like in the middle of a workday, they have to run to the restroom to change their bandages. So it's hard to keep this private because other people start to become aware of it. There's definitely a huge psychosocial impact on our patients where they tend to find that it affects their relationships with people. They're almost afraid to disclose what they're going through given the areas that are affected by this disease. The impact that we're seeing from the interventions we can take in controlling that inflammation has had a huge impact on our patients' day-to-day life. It's not nearly as uncomfortable, not nearly as impactful, and something that we can find that they have much better control of.